10 early warning signs of diabetes. Diabetes mellitus, also known as diabetes, is a metabolic condition characterized by elevated blood sugar levels. If left untreated, it is a chronic condition that can lead to a variety of severe complications. It's also known as the silent killer. Sounds terrifying, doesn't it? Watch until the end of this video and find out what symptoms you are extremely likely to overlook. Share it with your loved ones so that they also know this incredibly significant information. It's important to keep in mind that early diagnosis can save lives until it's too late. Number 1. Excessive thirst and increased urination. These are the most common signs of diabetes. Your kidneys are unable to consume any of the extra sugar in your body if you have this disease. As a result, it ends up in the urine, carrying fluids from other tissues with it. This causes you to pee more often and dehydrates you, which would make you drink more to quench your thirst, which leads to even more frequent urination. The vicious cycle goes on. How often is too much urination? Sure, we all have varying levels of movement and fluid consumption. However, the average healthy person urinates 6 to 7 times a day, with certain individuals urinating up to 10 times a day. So if anyone finds that their visits to the toilet are becoming more frequent than normal and are interfering with daily life, it might be time to see a doctor. Number 2. Constant hunger. Constant hunger is the third most common symptom of diabetes, after excessive thirst and increased urination. Your body can't turn food into the glucose your cells use for energy if it doesn't produce enough, or any insulin, or if it doesn't react to it properly. This results in increased appetite that persists even after meals. In addition to that, eating raises blood sugar levels more, making the problem even worse. Even if you don't have any other diabetes signs, if you keep eating but your hunger remains, you should see a doctor. Number 3. Chronic fatigue. Diabetes makes you feel weak and exhausted all of the time, for the same reason that it makes you hungry all of the time. Your cells don't get enough glucose to use as energy. This fatigue is worsened by dehydration, caused by frequent urination. Also, having to get up several times during the night to use the toilet isn't exactly helpful to getting a good night's sleep. Your body is simply drained of energy as a result of all of this. You get quickly irritable when you have chronic fatigue as well. Under these conditions, who would even be cheerful? Fatigue may be a symptom of a variety of other problems, some of which aren't even medical, such as a high-carbohydrate diet, too much caffeine, or aging, but when it's associated with the other symptoms on this list, it may signify diabetes. Number 4. Blurry vision. When blurred vision isn't caused by a specific eye condition, it may be a symptom of diabetes. It occurs as a result of the shifting of fluids, which causes the lens of your eyes to swell and change shape. This impairs the ability of the eyes to focus, causing images to appear fuzzy or blurred. These changes are often reversible, and once your blood sugar levels improve with medication, your vision can return to normal. But if diabetes is not treated, these changes may worsen and eventually lead to blindness. That's a high price to pay for completely ignoring a health issue. Number 5. Unintentional weight loss. This weight loss isn't the result of a healthy diet and regular exercise. Diabetes patients may lose 10 to 20 pounds in as little as 2 to 3 months. Since glucose cannot be used as a source of energy by the body, it switches to burning fat and muscle for energy instead, causing unintentional weight loss. Your kidneys can also be affected as a result of having to work harder to remove the extra sugar. Since your body uses all available fluids in a futile effort to generate urine, dehydration leads to unexpected weight loss. Unintentional weight loss is a common early symptom of type 1 diabetes, but it can also arise in people with type 2 diabetes. Number 6. Skin discoloration. Acanthosis nigricans is an illness that manifests itself as velvety dark patches of skin. These patches commonly appear on the collar, armpits, groin, within the elbows, behind the knees, and on the knuckles, where the skin creases or folds. Although this skin condition can also affect generally healthy people, it's a common sign of prediabetes or diabetes and should be evaluated by your doctor. Number 7. Itchy skin. As previously mentioned, excess sugar in the body is excreted in the urine, which brings fluids from other tissues with it. This, in turn, drains fluids from the skin, which then becomes dry and itchy. Scratching those dry areas can break open the skin and lead to infection, which is extremely dangerous. If you have diabetes, you must take extra care to keep your skin healthy and moisturized. Number 8. Yeast infections. Diabetes compromises the immune system, making you more vulnerable to infection. Yeast and other fungi grow in a sugar-rich atmosphere because they feed on it. As a result, yeast and fungal infections are a common symptom of diabetes. Women, in particular, should pay attention to this. Vaginal yeast infections could occur for reasons other than diabetes, but it's still best to double-check with a doctor. Number 9. Slow healing of cuts and wounds. High blood sugar not only causes inflammation in cuts and sores, but also causes poor blood circulation, making it difficult for blood to penetrate and fix skin damage, which may become more frequent because the skin becomes itchier. This concerns feet too, since diabetic patients commonly develop foot sores, which can lead to even more severe complications, such as amputation. If you found that your cuts and wounds are taking longer to heal than they used to, consult with your doctor. Number 10. Numbness or tingling in the hands and feet. As previously mentioned, high blood sugar causes poor blood circulation, and unfortunately, that poor blood circulation can damage your nerves. Since the hands and feet are the furthest away from the heart, they are the first to struggle with this problem. Schedule an appointment with your doctor as soon as possible if you have any of these symptoms, particularly several of them together. There are several assessments that can be conducted to determine whether you have diabetes. If you find a difference in your well-being, whether it's the signs on this list or something else, you should never avoid, delay, or postpone seeing a doctor. You must be willing to spend some money and time on your health, because it is, after all, the most valuable thing you possess. If you found this video helpful, click that like button and share it with your friends. Don't forget to subscribe to our channel, so you won't miss any of our upcoming videos.